Your party doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
socialist
right
healthcare.
Now, I am
and
the
they're going to dominate
Party.
you, Joe. You know that.
A chaotic first presidential debate is in the books. More than 15 million viewers expected to tune into the first part in Cleveland. But were they watching the way the candidates presented themselves, including with their body language and speech delivery? Well, joining us to discuss, we welcome Dr. Carole Lieberman, a board-certified Beverly Hills psychiatrist and also a best-selling author. Doctor, thanks for being with us this morning. Let's break it down, look at each candidate here. What moment did President Trump and Joe Biden each appear to be at their strongest, and which one they were struggling?
Well, Joe Biden, first of all, he came in and raising his hands and, kind of like a coach. Come on, folks. But then he spent most of the time yes, exactly. Then he spent most of the time after that somewhat quiet, contained, because his goal for the debate was primarily to keep his dementia from showing. I have not examined him personally, but I have watched many of his appearances, and clearly there are signs of dementia, which they were not as big, as large, as obvious as they have been in the past, such as when he forgot the words to the Pledge of Allegiance. So he was trying to sort of contain himself. But he did, show some signs, subtle signs, like when he said, "Shut up, man," different things. He was smiling inappropriately during the debate. There were subtle signs. The clip that was played before, you just played the clip where he was asked about the Supreme Court, and he started to say something, and then he got off track, and he started saying, "Vote, people. What you have to do is vote." I mean, that happened several times, but you could miss it because of the interruptions and so on. You could miss it. Now, Donald Trump, on the other hand, came out like a bull in the china shop, kind of like he is, but that's how he gets things done. That's his way of being that allowed him over these months to get all of these things done. And he was very aggressive. He did interrupt, which is kind of unfortunate, because I think Biden would have shown more of his dementia if Trump would have let him go on and show that he didn't have ends to his sentences. But that's what I'm most concerned about is for future debates, there should be some kind of a blood test to see whether Biden has taken some kind of a medication like Adderall, some kind of amphetamine and performance-enhancing drug. And there was a wire that one could see under his jacket. What that was attached to, I don't know. But all of these things need to be looked into, because as a psychiatrist, I can say that person doesn't go from being confused and having signs of dementia when they're in their home in a calm situation, or even out on the campaign trail, but calmer than in the debate. And now he's so much better. Yeah,
Doctor, I know. I want to get to this next point. I think some of the points you're making, they echo sounds of the Trump campaign here. Again, not proven yet, but definitely allegations. I want to talk to you, too, about, from the viewer perspective, some of us tuning in might have felt a little bit uncomfortable just when we're seeing both of these men really going at it. And, of course, we saw Chris Wallace attempting to try to gain some control. Did you feel as though there was any point in time when the candidates themselves felt uncomfortable on that debate stage?
Well, I think, as I was saying with Biden, when he had these inappropriate smiles, that kind of showed his discomfort. And I think President Trump, when he realized that the moderator, Chris Wallace, was protecting Joe Biden, over and over and over again from the big bad wolf, right? I think that's when he started to get really irritated and uncomfortable.
All right, that is Dr. Carole Lieberman joining us live this morning. Doctor, thank you for your insight and analysis as well. Very interesting to hear.